Most seniors don't realize it, but cancer often starts with silent signs. No pain. No panic. Just small, everyday changes that get dismissed as normal aging. But here's the truth. Over 60% of cancer cases happen in adults aged 65 and older. And still, symptoms like fatigue, weight changes, or unusual pain get brushed off. Why? Because they whisper, until it's too late. In this video you'll discover 10 overlooked signs of cancer in seniors. The same signs that doctors say are most often missed. And more importantly, you'll understand why seniors and caregivers tend to ignore them. Whether you're a senior, a caregiver, or simply love someone over 60, this could be the most important video you watch today. So hit that like button to help this message reach more families. And don't forget to subscribe to Seniors Vitality Hub, where we turn medical facts into life-saving knowledge. Let's begin, because recognizing even one of these subtle signs early could truly save a life. Number 1. Overlooked signs of cancer in seniors. Fatigue is one of the most common complaints among seniors. But persistent fatigue that doesn't improve with rest could be a red flag, not just of aging but of something more serious like cancer. We're not talking about the usual tiredness after a long day or a poor night's sleep. This kind of fatigue is ongoing, unexplained, and disproportionate to activity levels. It lingers for weeks or even months and can interfere with basic daily tasks like getting dressed, walking short distances, or preparing meals. This type of fatigue happens because cancer can disrupt the body's normal processes. It may be using up nutrients, altering metabolism, or affecting blood counts, leading to anemia and weakness. Unfortunately, many seniors dismiss it or attribute it to old age, arthritis, or medications. Even caregivers may overlook it, especially if the person still appears functional but slower. Cancer-related fatigue tends to come on gradually, making it even easier to overlook. You might notice that naps no longer help, or that simple chores leave you unusually drained. This is not normal. Even at age 70, 80, or beyond, your body should recover with rest. If you noticed you've been feeling deeply tired for more than 2 weeks without an obvious reason, it's time to take it seriously. Don't self-diagnose or delay. Schedule a visit with your doctor if fatigue is persistent and getting worse, not relieved by rest or sleep, accompanied by other symptoms like weight loss or pale skin, interfering with your ability to function normally. Early testing can reveal if there's an underlying issue like cancer, and early detection saves lives. Number 2. Overlooked signs of cancer in seniors is losing weight without trying. Might sound like a pleasant surprise, especially in a country where weight gain is often a concern. But for seniors, unexplained weight loss can be a critical warning sign of cancer. When cancer is growing in the body, it often affects how nutrients are absorbed and how the body uses energy. Cancer cells demand a lot of fuel, which can cause the body to burn calories faster than normal. Some cancers also release substances that disrupt metabolism or reduce appetite, leading to weight loss even if eating habits haven't changed. Many seniors already experience appetite changes due to medications, dental issues, or changes in taste. That's why gradual weight loss can be easily overlooked or misattributed. However, losing 10 pounds or more in a few months without dieting or exercising should never be ignored. In cancers of the stomach, pancreas, lungs, or esophagus, this is often one of the earliest signs. It can also signal cancers that are harder to detect in the early stages, making it especially dangerous if brushed off as a coincidence. Don't assume weight loss is a sign that something is going right. In seniors, even a small loss can affect muscle strength, balance, and overall health. Always monitor changes in body weight, especially if you're not making lifestyle changes. You should talk to your healthcare provider if you experience a drop in weight of more than 5% of your body weight within 6 to 12 months, a noticeable decrease in clothing size without effort, a consistent lack of appetite or early fullness, ongoing nausea or digestive discomfort. Even if you feel fine otherwise, unexplained weight loss deserves a closer look. It could be one of the earliest clues your body is giving you. For many seniors, digestive issues come with age. But when bowel habits change suddenly and don't return to normal, it could be more than just diet or medication. It could be a sign of cancer, especially in the colon or rectum. Which brings us to number 3. Changes in bowel habits. A healthy bowel routine can vary from person to person. However, a noticeable shift, such as going from regular bowel movements to frequent constipation or diarrhea, can be an early signal of something wrong in the digestive tract. Some seniors might also notice narrower stools, straining during bowel movements, or a feeling of incomplete emptying. These changes are often brushed off as minor issues, related to aging, diet, or dehydration. But when they persist for more than a few weeks, they should be taken seriously. Colorectal cancer, in particular, often develops slowly and quietly, which is why these signs are easy to overlook until the disease has progressed. Another warning sign is blood in the stool, which can appear bright red, dark, or even black and tar-like. Many people assume it's from hemorrhoids or minor tears, but blood in the stool, especially when combined with other bowel changes, should always be checked. As we age, regular bowel patterns become more important to monitor. Keep a mental note of your usual routine and any consistent changes. Contact your healthcare provider if you experience constipation or diarrhea lasting longer than 2 weeks, thin or pencil-like stools, blood in the stool or on toilet paper, frequent abdominal cramping, bloating, or a sense of urgency. Routine screening like colonoscopy can detect colorectal cancer early, even before symptoms appear. So don't ignore the signs. Early testing could be life-saving. Struggling to swallow occasionally might not seem like a big deal. But when it happens often or gradually worsens over time, it could be a warning sign of something more serious, especially esophageal, throat, or stomach cancer. And this is our number 4 overlooked signs of cancer in seniors. Difficulty swallowing, also known as dysphagia, might start subtly. It may feel like food is getting stuck in your throat or chest, or that you need to drink water often to help swallow solid foods. Some seniors experience choking, coughing, or pain when eating, which they might ignore or assume is due to aging muscles or dry mouth. But here's what's important. When a tumor begins forming in the throat, esophagus, or nearby structures, it can make swallowing more difficult by physically blocking the passage of food or by irritating the tissues involved in the swallowing process. This symptom often appears slowly, which is why it's commonly overlooked or misattributed to heartburn, acid reflux, or dentures. Over time, people may begin to avoid certain foods, eat less, or unintentionally lose weight, not realizing the real cause is more serious. Eating should not be painful or uncomfortable. If it starts becoming a challenge to get food down, that's your body's way of asking for attention. You should speak to a healthcare provider if you experience any of these signs. Frequent trouble swallowing solid foods or pills, a feeling that food is stuck in your throat or chest, pain when swallowing, drooling or unintentional weight loss, and needing to cut food into very small pieces to manage. These symptoms should not be ignored. Esophageal and throat cancers are harder to treat in later stages, but with early detection, there are more treatment options and better outcomes. Pain is a common complaint in older adults. Arthritis, back problems, and previous injuries can all cause chronic discomfort. But persistent, this is our number 5, unexplained pain that doesn't improve, or has no clear cause, may be a warning sign of cancer. Unlike typical age-related aches, cancer-related pain is often new, localized, and gradually intensifies. For example, ongoing pain in the back could indicate cancer in the spine, kidneys, or colon. Headaches that don't respond to usual treatment could be a sign of brain involvement. And persistent chest pain might point to lung or esophageal cancer. One reason this symptom is so frequently missed in seniors is because many people expect to hurt more as they age. But not all pain is just aging. Pain that continues despite rest, medication, or therapy, especially when it's located in a specific area, deserves attention. Another concern is night pain, pain that wakes you up or feels worse when lying down. This kind of discomfort is especially suspicious because it may suggest inflammation caused by abnormal tissue growth, including tumors pressing on nerves, bones, or organs. Never assume that all pain is harmless. Your body speaks through discomfort. If something doesn't feel right, it's worth checking. Talk to your healthcare provider if you have pain that lasts more than 2 weeks with no clear explanation, pain that continues to worsen or becomes more frequent, discomfort that interferes with sleep, eating, or daily movement, pain that comes with swelling, bruising, or unexplained weight loss. Getting an accurate diagnosis early can help identify whether the pain is due to cancer or another condition, and ensures you get the right care before symptoms worsen. Finding a lump on your body can be alarming, or easy to ignore. For many seniors, it's tempting to assume it's just a cyst, a fatty deposit, or a harmless bump from the past. But a new, unexplained lump or swelling, especially one that grows or changes over time, can be a serious warning sign of cancer. Which is our number 6 overlooked signs of cancer in seniors. Lumps can appear under the skin in the neck, armpits, groin, breasts, or abdomen. Sometimes they're painless, which makes them even easier to overlook. But even without discomfort, a lump may indicate abnormal tissue growth, inflammation, or a tumor forming beneath the surface. In seniors, cancers like lymphoma, breast cancer, soft tissue sarcoma, and even skin cancer can first show up as unusual masses. One reason this symptom is often missed is because lumps aren't always visible. They may only be felt during routine bathing, dressing, or by accident. Many people delay getting them checked due to fear, embarrassment, or the belief that if it doesn't hurt, it must not be serious. Unfortunately, this delay can allow cancer to grow unchecked. You know your body best. If you notice a lump that's new, growing, or changing in texture or shape, don't wait to bring it up. Make an appointment if you notice a lump that's getting larger over time, a mass that feels hard, fixed, or irregular in shape, swelling in the lymph nodes, especially in the neck, armpits, or groin, a lump under the skin that appears without injury or infection. Early evaluation is key. A simple physical exam or imaging test can often rule out serious problems, or help catch cancer early when treatment is most effective. Our skin naturally changes as we age. Wrinkles, dryness, and spots are expected. But some skin changes aren't just age-related. When a sore, patch, or mole doesn't heal, changes in appearance, or continues to grow, it may be a warning sign of skin cancer. Number 7. Skin cancer is one of the most common cancers in seniors, especially in people who've spent many years under the sun. In fact, many older adults think that sun damage from decades ago is harmless now, but skin cancer can appear many years after that exposure. What should you look out for? A sore that doesn't heal in 2 to 3 weeks. A mole or spot that changes in color, size, or shape. Itchy, bleeding, or crusty patches of skin. Dark streaks under fingernails or toenails, which can indicate melanoma. Shiny bumps, especially pink or red in color. These symptoms are often confused with skin infections, age spots, or dry skin. But when skin lesions don't respond to moisturizers or basic care, it's time to investigate further. Check your skin regularly, especially areas you might not see often, like your back, scalp, or the soles of your feet. Use a mirror or ask a loved one to help if needed. You should see a dermatologist or primary care provider if you notice a mole that grows, darkens, or develops irregular edges. A sore that bleeds, crusts, and comes back. A new growth that looks different from others on your skin. A persistent scaly or rough patch that won't go away. Early detection of skin cancer often means simpler treatment and better results. Don't assume a spot is harmless just because it doesn't hurt. A cough that lingers can be frustrating, but for seniors, a persistent cough or hoarseness that lasts more than a few weeks may be more than just a cold or allergies. It could be an early sign of lung, throat, or laryngeal cancer. That is our number 8 overlooked signs of cancer in seniors. Chronic cough is often brushed off as part of aging, side effects of medication, or a result of past smoking, even if the person hasn't smoked in years. But a cough that doesn't go away, worsens over time, or sounds different than usual should not be ignored. Hoarseness, on the other hand, is commonly mistaken for overuse of the voice, dry air, or acid reflux. While those causes are common, when hoarseness persists beyond 2 to 3 weeks, it could signal inflammation or a tumor affecting the vocal cords or nearby structures. In lung cancer, the cough may become dry or produce mucus, and in some cases, it can be accompanied by blood or chest discomfort. Seniors with throat-related cancers may also experience difficulty speaking clearly, frequent throat clearing, or the sensation of something stuck in the throat. If a cough or hoarseness becomes part of your daily life and doesn't improve, don't assume it's just a lingering cold or aging voice. Your body is trying to tell you something. Seek medical advice if you experience any of these signs. 1. A cough lasting longer than 3 weeks. 2. Hoarseness or voice changes without a clear cause. 3. Coughing up blood or mucus. 4. Shortness of breath or wheezing. 5. Discomfort in the chest when coughing or breathing. Lung and throat cancers are often detected late, which is why any ongoing change in your breathing or voice should be taken seriously. Catching these symptoms early can lead to quicker treatment and better outcomes. As we age, urinary changes often become part of daily life. More frequent trips to the bathroom, weaker flow, or occasional leaks. But certain changes in urination can be early signs of cancers affecting the bladder, kidneys, or prostate, and they're often overlooked. Changes in urination or blood in urine is our number 9 overlooked signs of cancer in seniors. One of the most important red flags is blood in the urine. Sometimes it's visible, turning the urine pink, red, or brown, and other times it's only detected through lab testing. Many seniors may dismiss this as a sign of a urinary tract infection or dehydration. But even small amounts of blood in the urine should never be ignored, especially if it happens more than once. Other urinary warning signs include a sudden increase in urgency or frequency, pain or burning during urination, difficulty starting or stopping the flow, a weak or interrupted stream, particularly in men, feeling like the bladder doesn't empty completely. In men over 65, prostate cancer is one of the most commonly diagnosed cancers, and these urinary symptoms are often the first clue. In women, blood in the urine or persistent urinary discomfort could be linked to bladder or kidney cancers. It's easy to chalk up bathroom changes to aging, but your urinary system has its own way of signaling distress. Pay attention to anything that feels out of the ordinary or that continues longer than expected. Schedule a medical evaluation if you experience blood in the urine even once, difficulty urinating or a weak stream, unexplained discomfort or pressure in the pelvic area, nighttime urination that's suddenly increasing, urinary changes that persist for more than a few days. Simple urine tests and imaging can reveal the cause early, giving you the chance to address issues before they become more serious. Don't let embarrassment or assumptions keep you from getting checked. Number 10 is unexplained bleeding. Is one of the most alarming symptoms, and for good reason. In seniors, unusual bleeding anywhere in the body can signal cancer and should never be ignored. This bleeding might show up as blood in the stool or urine, vaginal bleeding after menopause, bleeding from the mouth, gums, or nose without injury, persistent or unusual bruising or bleeding under the skin. Many seniors may dismiss these signs as minor injuries, hemorrhoids, or side effects of medications like blood thinners. However, cancer can cause blood vessels to become fragile or tumors to bleed internally, leading to these symptoms. Postmenopausal vaginal bleeding is especially important to report. It can be an early sign of uterine or cervical cancer and should always prompt a doctor's visit. Similarly, blood in the stool may indicate colorectal cancer, while blood in the urine could signal bladder or kidney cancer. Never ignore new or unusual bleeding. Your body is signaling that something is wrong and needs medical evaluation. Seek medical attention immediately if you notice any bleeding that is unexpected or cannot be explained by injury, blood in your stool or urine, vaginal bleeding after menopause, persistent bleeding from the mouth or gums, easy bruising or prolonged bleeding after minor cuts. Prompt medical assessment can help find the cause quickly. Many cancers detected at this stage can be treated successfully, so don't delay. Cancer in seniors is a serious health challenge, but awareness is your most powerful tool. Many of the signs we covered today, persistent fatigue, unexplained weight loss, changes in bowel or urinary habits, unusual lumps or unexplained bleeding, are often overlooked because they can feel like normal parts of aging. But they are not normal, and listening closely to your body can make all the difference. Early detection is key. When caught early, cancer treatment is often more effective, less invasive, and leads to better quality of life. That's why paying attention to these subtle warning signs and seeing a doctor promptly can save lives. Remember, caring for your health means trusting your instincts. If something feels off, don't hesitate to seek medical advice. No symptom is too small to discuss. Routine checkups, screenings, and honest conversations with your healthcare provider are essential parts of maintaining vitality in your golden years. If you found this video helpful, please like and share it to help other seniors and caregivers learn these life-saving signs. Subscribe to Seniors Vitality Hub and hit the notification bell to stay updated on trusted health tips tailored just for seniors. Your health matters, and we're here to support you every step of the way. Thank you for watching, and take care of yourself, because you deserve to live a long, healthy, and vibrant